I think the first thing that needs to be acknowledged is that everything that this pandemic is showing up and highlighting in this enormously tragic, escalation is has been very long-standing. I mean, the inequitable access to healthcare and healthcare services that we are all bemoaning at this point of time because it's so very visible and in our face. These are things that we have been plagued with for decades. This the inequitable access to healthcare, the problems of poverty, and so on and so forth, and more so in this region than in others, of course. I mean, it really, we need to be reflecting on why we never attended to these things decades and decades and decades, post independence in our countries and so on, and what the power structures have been that have kind of maintained this kind of inequity, which now is so very dramatic. And I hope that this drama that and the tragedy that we have all suffered is going to make sure that we don't allow invisibility to these issues again. And so I really welcome being in this on this platform. I'm also very humbled to be among so many peace activists. So I think that not only do doctors need to enter the peace activism domain, but the peace activists need to come in and support health, to say that all this is unacceptable. This degree of social injustice in health is totally unacceptable. Now, so what have we seen? I mean, you mentioned the first and the second lockdown. I think the second lockdown was not quite as severe as the first lockdown, Mandira, because simply because all of us had raised our voice, and it was very clear that the first lockdown had been disastrous upon people's economies, and simply didn't work. So the second wave has been dramatic for many reasons. One is the nature of the mutation of the virus itself, which has been much more transmissible and much more severe, and really has affected numbers beyond what anybody could imagine, and therefore has crippled existing health services. The second reason was that the gap between the first wave and the second wave, we simply did not use that time to plan adequately and to do many things that we could very easily have done to avert the tragedy of the second wave. And so the impact broadly is as is expected. If in our country, we have seen this very clearly, that if you're poor, you are absolutely, in some sense, devastated by this pandemic, because the huge escalation of poverty. Zafrullah mentioned food insecurity. People are dying out of food, and food insecurity and starvation and hunger. People are unemployed more than we've ever seen before in this country, and the kind of economic downturn is hitting people. Savings have been absolutely demolished. So where the next meal is going to come from for 81% of our workforce, which is in the informal sector, 40 million migrant workers. I mean, these numbers are mind-boggling, and they're all at the brink of disaster, really. So if you're poor, if you're working in the informal sector, if you live in a rural area where healthcare services, the reach has always been very, very deficient. If you're female, we are seeing now the gendered nature of pandemic. Your access to vaccines, for instance, is so much lower, and we're counting those numbers. If you belong to minority groups, and possibly also Dalit and tribal groups, but as we know, disaggregated data is simply not available. But also very shockingly and tellingly, there's analysis to suggest that if you belong to states which are not ruled by the
government.
rules at the center, your access to vaccines, for instance, is lower. I mean, this is the kind of shame that we are seeing, the lack of attention to equity in the past, the playing of politics and profiteering in the present during the pandemic. And I think this is what is really, really troubling us a huge amount. And so the impact is, clear for all to see. We've had 4 lakh counted deaths, but we know that the excess mortality is probably 10 times that. So Mandira, I mean, if you want me to expand on anything, I can, but I can want to make one point on, frontline workers. So in India, I don't know if people are aware that we have 4 million frontline workers, and they're all women, and half of them are not considered workers, don't get wages, don't get any social security, don't get PPEs and all that. And, and yet when we speak as leaders, we are saying that the response to the pandemic is kind of bolstered almost entirely by frontline workers. So this kind of, contradiction
washing away.
Is really something that we need to call people out on. Now, coming to, and mind you, not only do they face problems as healthcare workers, they share in the general problem of disempowerment that women in any case have within society and within communities. So now coming to the impact of the pandemic on women, it's been very, very complex. For instance, the lack of access I'll talk about, and the lack of access to vaccines and things, I'll just come to that. But before that, I mean, I think that we have to again see how domestic violence, for example, has really gone up. The way women have been forced to be sequestered within their households, and domestic violence anyway is something that's barely talked about as a health issue. We consider it a major public health issue, that women face violence every day, and especially domestic violence, but also societal violence, of course. And that has really dramatically risen with hardly any recourse whatsoever. The other thing that's happened is that women's contribution to unpaid care work has gone up tremendously, because everybody's locked down and they're taking care of sick people, they're taking care of children, they're taking care of themselves, they're trying to struggle to feed their families in a situation where there's just simply no food available. So the kind of stress that women are facing today as a result of the pandemic, and the response to the pandemic, or rather the wrong response to the pandemic, is very high. And in terms of access to healthcare, of course, it's the same old issues. The lack of decision making ability, lack of control over money, lack of mobility, not being able to move out without a male companion, and very important, the digital divide. So if you really look at, who owns, firstly, do all families own any access to internet facilities? I mean, I find this whole, response in terms of solution for e-medicine, telemedicine, it has its place, but it's by no means the primary kind of response that we need to make to this pandemic. We just need solid, basic healthcare services to exist, and they can be supplemented by telemedicine. But please be conscious, especially people living in the north of the globe, that the digital divide is another huge axis for inequity in our country. And it's being utilized for education, it's being utilized for food security, it's being used for, and if we propose that it's being, it is also used for healthcare, in which it is even very highly inadequate just in terms of technology, leave alone anything else. So I think that we should just be a little cautious before prescribing it as our first kind of response to, how to get there. Yeah, thanks. Yeah, I mean, I totally agree with Dr. Subedi on a lot of what he said, but I just have two thoughts that I'd like to kind of share. One is that the medical profession itself needs to enlarge its view of health, beyond medical care, and accept and acknowledge that that's really the tip of the iceberg, and that a lot of the health work that needs to happen in communities and families, and curing people of disease and sickness is really the last thing that we want. I mean, as a public health person, it's very much more important for me to focus on prevention, promotion, and so on and so forth. So I think that the medical community is not really good at that, and so they don't make very good leaders in terms of coalitions. They're very good at, there are a lot of associations of doctors just dealing with medical topics, and but not really so much with things that are so critical to health. Democracy is critical to health. Peace and justice are critical to health. So I think that we need more doctors who kind of take the risk to step a little beyond medical practice and so on. And I agree with Dr. Subedi on that. But on another front, I would also like to kind of place to the House that we believe that health decision making and kind of health intervention needs to be decentralized with capacity, and that requires a process of demystification of health, because health is something that all is very personal and intimate to each one of us, but we feel so removed from our own bodies and our own health because of the power of the doctor, the mystification around this knowledge being very technical and so on. So these are things that need to be broken down, in fact, rather than creating greater hierarchies. So I'm not very enamored by the idea of doctors from abroad, for instance, coming around to step. I mean, in terms of relief, yes, I'm not talking about the short term here. Now we're really going into, so short-term relief from anywhere, any means. We need short-term relief. With the governments and boundaries should open up for that and accept that and make it easy, which is currently not the case. So short-term relief for sure. But medium term and long term strategies cannot depend upon people from outside the country. It cannot even depend, like Jharkhand village cannot depend upon what a set of doctors sitting in New Delhi think. And that's been so evident in the pandemic. We've got so many things wrong just because of the centralization, just because of the technocracy, just because of the lack of participation from civil society, from public health experts, from community, from people who are affected. So in terms of the correctness of process, I think decentralization has to be marked. In terms of alliances and associations, yes, for those alliances and associations that respect their own limitations as a starting point and then see their own strengths as well. I mean, doctors bring in enormous power. They wield power enormously, but they need to recognize how to wield it for the good of all. Sometimes it just works only for the medical profession. So, I'm a doctor, but I have spent a long time introspecting about what doctors do, and I'm fairly critical about our own profession, as I think only doctors can be. Maybe outsiders don't even feel able to be.